Hello, I am Romanos Sklavenitis-Pistofidis. I'm an assistant professor in the Department of Integrative Translational Sciences at City of Hope in Duarte, California, and we're at ASH 2025. In my session, I talked about the use of genomic and immune biomarkers to predict progression from MGUS and smoldering multiple myeloma to overt multiple myeloma. Specifically, when it comes to genomic biomarkers, 2025 has been a tremendous year for patients with smoldering multiple myeloma and MGUS, as well as for patients with multiple myeloma, with whole genome sequencing-based risk stratification tools getting published essentially back to back. In my talk, I covered the one described in the Nature Genetics paper in 2025 by Irene Gobriel and her team, where we have the MM-like score, looking at single nucleotide variants, copy number variants, and structural variants, including some of the usual suspects, such as KRAS, NRAS mutations, MYC translocations, as well as gain or amplification of 1q, deletion 1p, and so on and so forth. And the MM-like score they showed increases the risk of progression to overt myeloma independently so compared to the 2020 model of tumor burden. And then more recently, we have a big major publication by the IMWG group led by Francesco Mara and Vincent Rajkumar. And in that publication, we have a distinction between genomic events that determine malignant transformation, which places a patient at risk simply, versus genomic events that signify aggressiveness and therefore place the patient at higher risk. And so looking at patients from that perspective, they come up with a 4-factor model looking again at RAS mutations, MYC abnormalities, ApoBec activity, as well as copy number variant signatures to refine the classification achieved by the 2220 model. And so specifically, if a patient is classified as high risk by 2220, they would now have to have at least 2 of these genomic high-risk factors in order for them to still be considered high risk. They would otherwise be downstaged, and vice versa for someone who is classified as low risk based on 2020, they would require, but they have, in addition to their low-risk stratification, they have at least 2 of these genomic variables. They would now be upstaged to intermediate risk smoldering myeloma. And with the new high-risk myeloma criteria as well being published this year and the ensuing push for whole genome sequencing-based assays in the field, I think this is a great opportunity for models like that to also be introduced in our daily practice for patients with MGUS and smoldering multiple myeloma.